Hi, welcome to the next vlog we've got from Lanier Family Healthcare, Victory Direct Care, and now Auris Vein Center. First of all, I've tried to rearrange the email delivery system so that hopefully more people will be getting this. So don't hesitate to pass it on to others if you wish. I've got a bumper sticker I created for fire, police, sheriff, nursing, and EMS that proceeds, the profits from it will go back to the fire department to help out any firefighter that's having financial difficulty or health conditions. As far as the hospital is concerned, I'm no longer using internal medicine service. They seem to have a problem with communicating with me and letting me know that my patients were admitted in the hospital. So I'm using Doctors Moman and Patty R. Great guys, great doctors. I think they'll be a great asset to helping me out, and because they promised to let me know and make sure my patients were well taken care of. Big news, August 18th, 7 p.m. out here at the Victory Village Courtyard, University of Georgia tailgate party. There'll be football players, former football players will be showing up signing autographs. A couple of them you may remember. Jay Rome was a tight end for Georgia. Musa Smith, who was a running back for Georgia, and Keith Marshall, who just recently left Georgia right before the Chubb-Sony Michel combination was here. He was there with Todd Gurley. The purpose of this vlog is to talk about vaccinations. I've had a lot of questions about those lately, and right off the bat, talking about Shingrix and Zostavax, the two shingles vaccines. Zostavax is not as effective. It's only about 51% effective, where Shingrix is, I wish they could be, can you come up with a better name than that? Is 97% effective. It is 2 shots. So Shingrix is recommended from 50 and over, but you know, it will help prevent your chance of getting shingles. I do not know how insurance covers it yet. You'll have to contact your own insurance to find that out. But it's clearly a better vaccine. But more importantly, it is a dead virus, where the Zostavax is a live virus. So if you're getting one of the biologics for rheumatoid arthritis, psoriasis, for Crohn's or colitis, or you know, one of those conditions, you can get a live vaccine. This one is dead, so you know, they didn't just break its leg like they did with the Zostavax. They beat it to a pulp and killed it, and so it is safe to use. The next vaccine is pneumonia vaccine. It's actually 4 total, 2 of 2 different kinds. You got your Pneumovax and your Prevnar. The Prevnar is the better vaccine because it covers the 3 conditions that pneumococcal bacteria cause: meningitis, bacteremia, and pneumonia, where pneumococcal vaccine, Pneumovax, just really covers the bacteremia and meningitis. All 3 are serious. If you're a healthy individual, you really don't necessarily need this vaccine, in my opinion. I won't get it. I'm over 50. I'm not going to do it because I can treat the symptoms as they come on. The compromised people, the people with bad lungs from smoking, heart disease, bad diabetics, chronic liver disease, chronic kidney disease, these are the people that need this condition. People immunocompromised, like from cancer with chemotherapy, HIV patients, they should get this vaccine. And definitely, if you don't have a spleen, whether if you weren't born with it, you had sickle cell, or if it was removed from a trauma incident, you need this pneumococcal and Prevnar vaccines. So you'll get Prevnar first. I would do that one first if you haven't got it. Get the pneumococcal a year later, and then 5 years later, repeat that cycle. Next, the Tdap, the tetanus, diphtheria, and pertussis vaccination. Tetanus, you really need every 10 years, along with the diphtheria. Tetanus is a bacteria that, Clostridium tetani, when it gets into your bloodstream, it goes straight to the nervous system, causes lockjaw, causes severe back spasms, and it can be devastating. When the symptoms show up, it's too late. There's not much we can do. So you want to have that vaccination on board. Diphtheria is an infection that affects the tonsils, covers them with a white coating, and gets into the airway and can be a devastating type infection. Pertussis, whooping cough, the vaccination is not 100%. You can still get the infection even with the vaccination, but hopefully it makes it less aggressive. The big thing with the pertussis is it really attacks the very old and the very young. So if you got somebody that's pregnant, getting ready to deliver, have a young baby around, if you don't know that you're up to date on your pertussis, it's probably a good idea to get it ahead of time just to be safe. So, got to have a joke for the blog. And this one is a guy comes in to see the doctor,
He says, doctor, I got this voice problem. I'm not sure what to do about it. I can't make it go away. It's been this way a long time. What am I going to do, doctor?
And so the doctor says, well, we've looked at all your results, all your tests. All we can find is that you're over-endowed in certain areas. In other words, where most guys have 2, you've got 4. And so that you've got a little higher level of activity going on in your body. And so that's what's causing this voice problem. And the only way to correct that would be to remove those extra things that you have. And he says,
Well, doctor, I can't stand this anymore. I want to go. I want to have the procedure. I want to get rid of this voice. I want to take care of it.
he's all right. So he scheduled the surgery. Everything went well. About 6 months later, the guy comes back to the doctor and he says, Doc, I changed my mind. I missed the other aspects of the condition I had, so that I would like to, I'll suffer with the voice, but if I can have myself back the way it was, I'd really appreciate that. And the doctor says,
Well, I'm not sure we can get it back the way it was before.
y'all have a great day.